Hey everyone, thanks for joining us for our Q&A session today. Sorry for the delay, we ran into some technical difficulties. But we've been really excited to get a lot of questions from everybody over the week about what you're hearing in the news about the coronavirus pandemic. And so we wanted to take this opportunity to run through a bunch of those questions that have come through. So let's get started. Our first question is, are you immune to infection after you've recovered? And this is a really important question to think about, and it's one of the most important ones that have come through, so we wanted to get to it first. So when we think about what's happening in your body after you get the virus, your body mounts an immune response where you have cells that learn what the shape of that virus looks like, they start recognizing it, and they start breaking it down as well as they can. And there are cells in your immune system called memory B cells, whose job it is, as your infection starts to wind down, to remember that particular germ. And they're stored in your body long term, so that if you encounter the germ again, those memory B cells can reactivate your immune system and kick that response back into gear. So we expect that the same thing is happening during an infection with COVID-19. And so based on what we've observed from people so far, it does seem like that your body does respond in that way. You generate those antibodies that attack the infection, and we expect that those antibodies will be maintained long term. Now, there have been some observations of people who have been infected, tested positive, recovered, and then tested positive for the virus again. And there are three possibilities for why that might happen. One is that they may have just had a long-term infection that didn't entirely go away. A second possibility is that a test might have been faulty. And a third possibility is that they might just have a weaker immune system that can't fight off the virus as well. But from the population data that we're seeing, it does seem, though, that you do acquire some at least short-term immunity to the virus. Whether that translates long-term, we just don't know yet. For example, if you think about when you get a tetanus vaccine, you need to get a booster every 10 years because your immunity starts to weaken. There's a chance that may be the case, and we'll find that out over time. But for now, what's important is that even this short-term immunity is going to help control the spread of the pandemic. Okay, next question. Can you prevent infection by drinking a lot of water? So this one, I think, comes from a meme that many of us may have seen making the rounds on social media, that supposedly Japanese doctors say that if you drink water every 15 minutes, then that water will flush the virus down into your stomach, and at that point, the stomach acids will degrade the virus. So that's unlikely to be true, because the virus is so small and it operates at such a small scale that when it's attaching to the receptors in your airways, water isn't going to be able to wash that away. The virus can infect you, in your nose, in your mouth, and in your upper respiratory tract, which is different from where water moves down your esophagus to get down to your stomach. So short answer is that, keep drinking water just because it's good for you to stay healthy, but it's not going to influence whether or not you get infected. Now, one word of caution here is that one of the reasons that I think people wanted to believe this is because of this appeal to authority that, Japanese doctors who have had experience with this are saying this, so there must be some truth to it. But in fact, in an age where we're getting inundated by so much information, we need to make sure that we're checking our facts and checking sources before we start putting too much confidence into anything. Okay, next question. Can cats get infected? I think all of us who have pets are really concerned about this question. And it's possible that because cats and dogs are mammals just like us, that they may have similar receptors that the virus can attach to. So far, I've read about one case of a dog in Hong Kong who has been shown to be a carrier for the virus. But we're not seeing widespread evidence at this point that many pets are carrying the infection in a way that would suggest that they're being reservoirs that then pass the virus back to humans. So until we have more evidence along those lines, most health organizations are recommending that people interact with your pets as you normally do, but keep washing your hands. Okay, next question. Do infected and infectious mean the same thing? So that seems like a kind of a terminology question, but in fact there's an important distinction between being infected and being infectious. If we think about it, everyone who's infectious has been infected because they have the virus, but just because you're infected does not mean you're yet infectious. And this is important when we think about some of the mathematical models we've talked about earlier in the week in terms of the disease dynamics of how the disease is spreading throughout the population. We talked about a simple model where people can be categorized as either susceptible, infectious, or removed from the population. And in fact, if you go one step more complicated, there's a fourth category where you're exposed. And that falls right in the gap between infected and infectious. When you're exposed, you've contracted the virus, but you're not yet at a point where you're able to spread that virus to somebody else. And again, that does have an important impact on how the disease is spreading throughout the population. All right, let's move on to our next question. Does blood type affect the likelihood of getting infected? Now, this is a question that's come up this week because of some very preliminary studies that came out of China. Some context around this. What's really exciting in science right now is that there are many, many scientists who are actively sharing their research and publishing it freely and accessibly online. Which is really amazing in terms of spreading knowledge very quickly and generating new data. That being said, as these papers are often published before peer review, which means that other scientists have not yet had a chance to review methodology and make decisions about the validity of the results, that a lot of these papers are putting out hypotheses that really need a lot more evidence and more repeated experiments before we know what they really mean. So this paper that came out this week as a preprint, again, that means not yet peer-reviewed, looked at the distribution of A, B, AB, and O blood types in the general population in 2 Chinese cities, and compared that distribution with the percentage of blood types among a population in the same 2 cities who had been hospitalized for COVID-19. And what they found was a small but significant difference in the distributions, so that there were more people with blood type A who had gotten infected than what you would predict from the regular population. And on the reverse, there were fewer people with blood type O that seemed to have gotten infected. Now, there are some hypotheses about why this could make a difference, because different blood types have different proteins on the outside of your blood cells that could potentially interfere between the binding of the virus and your receptors. But we need more evidence before we know whether this is really happening. And no matter what, in terms of all of the different factors that affect any one person's likelihood of getting infected, your blood type is probably pretty low. So again, keep washing your hands. All right, next question. Can viruses attack bacteria? Yes and no. So there are viruses that attack bacteria, but they're not the same kind of viruses that attack us. So something like a coronavirus that is very specifically structured to fit as a lock and a key with a human receptor in a cell is going to be very different from the type of viruses that infect bacteria. There's a whole separate category of viruses called bacteriophages that work kind of similarly. They're still injecting their genetic material into a bacteria and taking over the cell to replicate. But those two types of viruses are very different when you look at what the viruses that affect us. All right, next question. Can the virus survive on hair? So as we go about our daily lives thinking about where we might pick up the virus, even without thinking about it, we're looking at all different kinds of surfaces and how long the virus is likely to survive on those. We know from studies that when you look at solid surfaces like stainless steel or plastic, that the virus can survive for days. Again, this is why it's important to disinfect frequently. But when it comes to porous substances, like our hair, for instance, it's much less likely that the virus can survive for a long time because it just tends to get trapped inside the pores in those surfaces. So short answer again here is that the virus might last for a short while on hair, but it's not gonna last for days. So if you're practicing good general hygiene, you're probably okay. All right, should you treat a fever or should you let the body fight on its own? I think this is a question that is a much more general question even that goes beyond COVID-19. Fever is a general part of the immune response, and scientists actually think that elevating the body temperature actually activates some portion of the immune response. And so should we suppress it, or is that just part of the natural process of fighting that infection? And there isn't really a clear-cut answer here because most of the studies that look at the effects of fever really look at critically ill patients. So it's limited in terms of what we can apply from those studies to what it means for those of us who are just fighting a fever every day. But the general practice here that most doctors recommend is that if you've got a low-grade fever, say 100 or below, let it run its course. If you start to feel uncomfortable, then it's okay to take some fever-reducing medicines, just to make yourself feel a little better. No one needs to be miserable. And along those same lines, another question has come up this week about whether it's safe to take ibuprofen. And this was really triggered by a tweet from the French Minister of Health who tweeted out about some patients who had some serious side effects from taking ibuprofen. However, again, this is where it's really important to look at evidence. Even though we do have some anecdotal data about patients who have had side effects for ibuprofen, we don't know at a population-wide level whether it makes a difference or not. When you look at any small number of people, there's always a chance that they have some different factor that makes them susceptible to something that isn't present in the general population. And so at this point, health organizations, including the World Health Organization, are recommending that it is okay to continue taking ibuprofen if that's what you're doing. But of course, with any kind of specific medical condition, whether it's a fever, whether it's potential side effects of ibuprofen, please talk to your doctor. All right, do we have any other questions that we should talk about? Yes, okay, what do we got?
Can people who are immune compromised go out at all?
Can people who are immunocompromised go out at all? Now, again, for any particular condition, we do urge you to talk to your doctor. But the question here, I think, is not necessarily just going outside, but how close you are to somebody else who could potentially transmit the disease to you. So if you're going out into your backyard and you're staying, keeping your distance away from other people, it's good to get some fresh air. Like, we all need that for our mental health. But you don't want to be going outside where you might run into people. And as we're hearing more and more cities start to talk about shelter-in-place practices, this is really intended to protect people who are immune-compromised so that they don't have to just stay isolated in their house. Please do your part to keep yourself socially isolated so that we can protect those of us who are at higher risk. Any other questions?
If you touch a toy and you may have the virus but don't know, can the next person who touched the toy get it?
Okay, so if you touch a toy, maybe you don't know that you're infected, and could the next person pick up the virus from that toy? And the answer is potentially yes. This is why my mother actually works in a library where they had a lot of toys, and even over the last few weeks, not only were they sanitizing the toys frequently, they were taking toys out of circulation where it was likely that where it was harder to clean those toys, because any of these kinds of surfaces are potential places where you can pick it up. And especially with children, we know that children are just putting their hands all over the place. And it's very hard to control what happens to a toy after one child plays with it to the next. And so again, this is another reason to keep your kids at home where you can, again, keep those germs and that contact contained. Anything else?
Yes. Can the virus survive certain types of soap?
Okay, can the virus survive certain types of soap? So soap, by its chemical definition, is a type of molecule that actually breaks up other types of fatty molecules. So pretty much any kind of soap, as long as it's actually soap, will break up those fatty layers that make up the outside shell of the virus. Now, some sort of like cleanser or some of these other words that are used in some products that are often said like, gentler on your hands than soap. If it's not soap, then it's not guaranteed to break up the virus. But any type of actual soap will do the trick. Anything else? Okay, we've got other questions coming in. So we'll wait a minute to as we see that come in. Okay, what do we got?
What about COVID-19 in summer months? Will it be stifled or keep going?
Okay, this is an excellent question. We see with the question is, will COVID-19 die down over the summer? We don't know yet. We do see seasonal patterns in other viruses. So, for instance, those of us here in North America are very familiar with the seasonal flu. It peaks every winter and then dies down over the summer. So, could this virus follow a similar pattern? The question, I guess, we just don't know. We don't have evidence yet to know these seasonal patterns because the virus has only been around for such a short time. But what we are seeing is that the virus does not seem to be geographically contained to colder environments right now. We're seeing infections in Australia. We're seeing infections, even down in Florida. So even places that are already hotter and more humid, it don't seem to be, any more or any less affected by the virus than some colder places. So we just have to wait and see, unfortunately. All right, you've got another question coming in?
Yes.
Okay, let's we'll wait for that one to come in. But while we're waiting, though, I think one thing that I wanted to talk about more generally is that why we need to take some headlines with a grain of salt, because we are living in a news cycle where people are, frankly, scared about what's going on. We want more information because it's human psychology to feel like the more information we have, the better prepared we can be. But we're also in a phase where the information is coming out faster than we have the ability to process and check the evidence on it. Again, this goes back to whether we're talking about scientific research or memes on social media. So as we continue to talk about this, please keep sending us your questions because we can help make sense of it for you.
Do we know when this virus will peak?
Do we know when the virus will peak? And again, the answer here is it depends. So right now, based on the data that we're looking at in China and South Korea, it looks like those two countries may have gotten over their first peak. What happens to countries like the US and other countries that are still on the upswing really depends on what we do to help control it. And this is, again, why social distancing is so important, because it's our own behaviors that will help shape the curve. Now, we know for now that we still have not yet reached the peak where we are. And you hear a lot about this idea of flattening the curve, of trying to spread out the peak to minimize the impact of our healthcare system at any one time. So the more that we can do now, the longer that peak will take to get to arrive, but the more prepared we'll be to manage that peak. Now, once we've got over that peak, though, there are likely to be more peaks coming along the line. And this is because even as we keep our distance from each other to try and maintain lower levels of infection, that also means that there are people who aren't getting infected in this first wave. And those people will be susceptible to getting infected later on in time. And so, we may, as we start to relax this first phase of social distancing, we may see the next peak come along and have to revert back to some of these practices. So as mathematical modelers are looking at the future, I think we're in this for a long haul for now, where we're not yet even over the first peak, and there may be future peaks to come.
How similar is COVID-19 to SARS-CoV?
So how similar is this particular virus that causes COVID-19 to the virus that caused SARS a few years ago? So they're actually quite similar, and that's reflected in the terminology that epidemiologists are using. So the virus that caused SARS a few years ago was termed SARS-CoV, so SARS coronavirus. And this virus is similar enough that the technical term for the virus is SARS-CoV-2. I actually read somewhere that there are people who are now referring to the first virus as SARS Classic, like it's Coke or something. So that's confusing sometimes for those of us, who are encountering it in the popular literature. But it's actually also really helpful because we can look at what we learned about the SARS coronavirus a few years ago and use that as hypotheses to test for the virus that we're encountering today.
Why does the number of people infected seem to change from report to report?
Why does the number of people infected seem to change from report to report? That's a really good question, because how do we make sense of these numbers? And there are a couple of different things going on here. First of all, of course, we're still seem to be in the exponential growth phase of the epidemic. That we haven't gotten it under control yet, so we're seeing these numbers go up by factors of 10 over just a few days. But that is also reflecting how well we're looking for people who are infected, and that's dependent on the number of tests we have. So in yesterday's conversation, we talked about how these tests work and some of the limitations on why we can't be testing more people than we are right now. And so there's a concerted effort to get more testing capacity online. And as the number of tests increase, as we loosen the criteria for who's able to get tested, we're going to be seeing those numbers go up. Not necessarily because the infection is suddenly spreading more widely, but because we're better able to catch it.
I have emphysema. Is there anything I can do to prepare myself for the virus?
So emphysema is one of these pre-existing conditions that influence your lung capacity. What can you be doing to protect yourself? The answer is, do what your doctor is recommending that you always do to keep that condition in check. So you're probably staying away from places with smokers, but we're in a time of social isolation where you should be doing that even more so. For many of these chronic diseases, the best thing that all of us can do is, and this is why, again, it's so important for us to respond as a community, that it's really on all of us to help protect you. That, as much as you can do to stay at home and wash your hands and stay away from other people, it's on the rest of us to stay away and wash our hands as well.
If I use elderberries in my food or drink the syrup, will that keep away the virus from multiplying in my body?
So I'm not actually familiar with the particular chemical components of elderberries. However, what we do know is that viral infections themselves do not have any particular cure. So you just have to wait it out for your immune system to either fend off the infection. Now, there are of course things that you can do to ease the symptoms. So, if you do have some of the symptoms of a dry cough or a fever, you can take medicines to reduce your fever. You can take or you can drink a lot of water to just ease some of the pain in your throat. But in terms of a cure, there's nothing that's going to cure the infection. We just have to wait for either a vaccine to be developed to help us not contract the virus in the first place, or there are some drugs in development right now that may help reduce the severity of the virus.
That was the last one.
All right, so great questions, everybody. Thank you so much for joining the conversation. We'll be back again on Monday talking about some more science, so keep your questions coming. And we look forward to seeing how we can keep helping you just make sense of what's going on in the world in a very confusing time. Thanks a lot.